Let us talk about the cervical cancer and its vaccine today. Cervical cancer is one of the very common cancers occurring in Indian women, and it is detected very late in India, leading to a very high death rate. Let us first understand what is cervix and where this cancer occurs. So if we look at a rough diagram, this is the female reproductive organs, this is the uterus, this is the vagina. Both the sides there are the fallopian tubes and the ovaries. So this corridor-like structure towards the cavity of the uterus is called the cervical canal, and the opening is the cervix. So we are talking about cancer of this part of the body. As you can see, cervix is a very deep-seated organ, and so the symptoms of this cancer are detected very late if not reported timely. Also, the specific program that we have to detect cancer in its early stages, called the pap test, is not done by all women in India, and so we are picking up this cancer very late, leading to a high death rate. Cervical cancer actually is caused by a virus. Yes, a virus is causing it, and the virus is the HPV virus. 95% of these cervical cancers occur because of 4 strains of this virus mainly. Since we know the cause, we have a cure against it. Just like the corona vaccine, this vaccine too would lead to the production of antibodies, helping us fight this infection, thus preventing cancer. This vaccine is called the HPV vaccine. It has a specific schedule which has been recently revised by the WHO. So now, girls between the ages of 9 to 15 years need to take only a single shot of this vaccine. Beyond 15 years, between 15 to 20 years, 1 or 2 shots taken 6 months apart are enough. 20 years and beyond, or people who are immunocompromised, need to take 3 doses of this vaccine. These doses, when taken timely, give lifelong protection against cervical cancer. India has set a target for this vaccine now. By 2030, we target to immunize at least 90% of girls by the age of 15. Also, we have set a target to screen at least 70% of our women around the age of 35 for cervical cancer. Cervical cancer screening is done by a simple test called a pap test. A pap test helps us detect the infection with this virus, and it helps us detect if these infections are slowly turning to cancer. It is a very simple, painless test, and it should be done by all sexually active ladies around about the age of 21 years every 3 years. Timely screening and vaccination would help us bring down this cancer in our country. HPV infection not only causes cervical cancer, but it causes other cancers like the vaginal cancer, the vulvar cancer, even oropharyngeal cancer like the throat cancer and anal cancers. In boys, it may cause genital warts too. And so, irrespective of gender, that is, all young boys and girls ideally should be vaccinated against HPV. Also, we will soon have our own vaccine manufactured in India, which would make the HPV vaccine very affordable. Thank you.